So today we're going to talk about healing after severe obstetric lacerations and the physical and emotional recovery that follow a traumatic birth. Today I'm joined by Dr. Brian Grogan, also known as Dr. Bree, and she is a pelvic health physical therapist who helps women better understand their bodies and recover from pelvic health challenges after pregnancy and childbirth. Dr. Bree, welcome.
Thank you. I'm so happy to be here.
Thank you. And I'm especially excited for today's conversation because I've personally benefited from the impact of your work. I did the Live program and it was really transformative for me. One of the biggest shifts that you helped me with was understanding that healing isn't just about strengthening. Because at first I thought, this area of body's injured, it's weak, I need to like go, go, go. But what I really needed was to release and lengthen first. And I learned so much about the mind body connection through you. The things that we tell ourselves have a huge influence on our healing. And it helped me change a story I told myself. Instead of believing that I was broken, I started thinking, okay, I can do this. I've got this. I'm really honored to have you here today for this
Mm.
conversation.
Well, thank you. That's just so delicious for me to hear everything you just said, that it landed for you, because I was actually just writing a little email newsletter this morning and preparing some things. And in it, I was thinking about the fact that, like, I love the word balance. I love that at the time of this recording, equinox is coming up, the spring equinox. And it's just a time of balance, you know? And the thing about balance is that's what my programs and my work is really all about, that balance of the mind body connection, the balance of physical things that you can do to help yourself and mental emotional things you can do to help yourself, because it's all connected. And the problem is that balance and these holistic approaches aren't super flashy and sexy and quick, and like, they take some time. But the thing is, they work. They work long term. And like you said, you're still carrying some of this information with you today, and you will for the rest of your life. And honestly, a healthy pelvic floor is a healthy life until the day you pass away, So everything you learn to keep your pelvic floor healthy and strong will help you until the day you die, as far as living your best, most healthy life through this very balanced approach that does look at all aspects. So thank you for taking it seriously and listing it out and sharing that. Yeah.
Yeah, thank you. So before we start talking about the physical side, I wanted to acknowledge kind of what we're just talking about, the emotional impact of all this. In our community polls, 74% of these women said that their severe tears, these births they viewed as traumatic.
Yeah.
And then on top of that, 34% reported suicidal thoughts or ideation, and
Oof.
27% had been diagnosed with postpartum PTSD.
Yeah.
So for mothers that are dealing with all of this, when it comes to healing both the mind and the body, like what's a good starting point?
Yeah. I mean, those statistics they're just huge. Those are really, really big to name. So thank you for that. And I mean, the first starting point that I always go to is really the nervous system,
Mhm.
because of what a person has just been through with this trauma, this birth related trauma, which is so wrapped up in so many layers of emotion. People have different emotions around the birth of a baby. It's not always just flowers and balloons and joy. Like, there can be a lot of emotions that come up, especially if there's injury. And so I actually just listened to a presentation by a colleague, and I took a screenshot of some more statistics, and this might be a good time to share them kind of
Yeah.
in relation to like starting with the nervous system. One screenshot that I took is about research insight into post-birth sexual pain. And it
Mm.
says approximately 1 in 4 women continue to experience pain with intercourse 1 year after giving birth. And so
Wow.
this is about 22% at 6 to 12 months postpartum, and about 21% still experiencing pain at 12 months. So about 22% at 6 to 12 months, 21 still experiencing pain at 12 months. And this is just general population. So it's
Wow.
higher rates with tearing or scar trauma. So it just really highlights that tissue healing timelines, they don't always reflect this intimate readiness to return to life, to return to intimacy. And intimacy is just a small piece of this whole puzzle. But it is an important piece that needs to be discussed and highlighted. And when there's that type of pain, when there was that type of trauma, our bodies will respond by protecting us, by guarding, by bracing. And so that is why nervous system regulation techniques are so important. So rather than working to get your body back after baby and working to do your kegels and etc., it's like, how can we actually just reconnect with this part of us that we might not want to connect to? after this happened. So even that, even a reconnection practice takes time and slowness and tenderness and care. So just simply deep breathing is a powerful place to start. And of course, talking to an expert if you think that you may need mental health help or somatic therapy or working with a trained provider who really understands birth trauma is so important. It's not to be dismissed because this is a big deal, what just happened.
Oh, yeah.
Yeah.
I think a lot of women don't have that care incorporated into the typical postpartum protocol. Certainly something we need more attention around. Just to
Right.
let women even know that these resources exist and that what they're experiencing is common
Yeah.
and but that it's not always going to be like this. They can work towards healing.
Yeah, exactly. And just very, very gradually, like again, we're not you, the person listening right now, you're not broken. Your body has changed. There's been a change, but you're not broken. And so again, just that gradual reconnection with self through, again, just connecting with the breath, even just connecting into the diaphragm. If you aren't wanting to like breathe down into your hips or breathe down into your yoni, right away, it's like just breathing into your diaphragm. Just getting the breath down, extending, lengthening the exhalations, maybe touching parts of your body that aren't straight to the area that was injured, not straight to the vulva, not straight to the belly, not straight to these areas, maybe more your inner thighs, maybe just touching your arms and your hands very slowly, like reconnecting with your body as a sacred space that just did something so powerful and so big, but connecting from the outside in. I think that as a society, we go straight to the action too quickly. Oh, we had the injury in our vagina. So let's go straight to the vagina with pelvic floor internal exam and pelvic floor therapy and Kegel exercises and strengthening and scar massage and whatever right away. But it's
Mhm.
like, no, let's actually slow down. Again, I'll say it again. This was a big deal, what happened, and how can we take a step back? Because just like I picture in my head right now, like a scared animal, our body is an animal. And when there's fear, they brace and they guard, and kind of like a scared dog or scared cat is going to kind of tuck their tail under and curl and slink away if they're scared. You can't just go straight in and start petting the dog. You have to like ease in. And our bodies are very animalistic. They are animals. We're the same. So we have to ease into these treatments.
That's great advice. What would you say is a kind of a realistic timeline? And I know everyone's so different, but well, first, how long after the injury should people start kind of this reconnection?
Yeah. I mean, I think start the reconnection as far as a mind body, just self love, self compassion approach right away. And
Okay.
I've always said right away, you can start with breathing exercises. That's a great exercise too. If we want to talk about physical, it is a great physical exercise. And it's just a great way to, again, get in touch with your body. So again, just breathe into the diaphragm, like diaphragm first, that umbrella shaped muscle of respiration that's at the base of your lungs. It's down there. So breathe down into your deep center diaphragm area. Let your ribs expand a little bit. Try to keep your shoulders still. It's like bringing the breath down, but not worrying about going so far down. Because I remember when I gave birth 19 years ago, I was so shocked by how little connection I had anywhere in my vagina area, my pelvic area, my belly, like no connection. And I did not actually experience tearing. So I was lucky. I had a pretty trauma-free birth experience and still so little connection. And so you don't want to add fear of like, oh my gosh, I'm doing it wrong to the
Right,
process. So just
right.
just breathe, just connect, just like love your body for what it went through. And then as far as other reconnection practices, like sort of getting more into the practice as you go. I would say you can begin self-touch as far as outside in approaches, like different parts of the body, inner thighs, legs, belly, if that feels good. You can begin that as soon as you'd like. Again, just bringing that awareness out of your head, out of the fear, out of the worries and anxieties and into your body and just approaching your body with, okay, all right, this is me. This is powerhouse me right here. And you can bring that in quickly as well, whatever feels comfortable to you. As far as timelines, though, I think that study that I shared from the talk I went to with my colleague, it really shows that there are no timelines. We give this like 6 weeks rule to folks, and it's like, well, I mean, I guess as far as like histological, like is that the right? Yeah, that's the right. I have not used that word in a long time, but tissue changes, like healing changes,
Right.
those may happen around 6 weeks. We're starting to see, things shift, but everybody's different. And so I think that the best thing is really that outside in approach, slow approach, not to expect the healing to be done in 6 weeks because probably it won't be. And that's
Yeah, I think
okay. Yeah,
I think that's what people need to hear is that 6 weeks it's used as a barometer, but it's not very realistic. And I think very many people are experiencing things far after that.
absolutely.
And that kind of brings me into another question is at what point, and again, I know this varies person to person, but at what point when people are experiencing like a lot of the common symptoms after severe tear could be urinary and fecal incontinence, urgency, incomplete bowels, prolapse. And when we talk about pain with intercourse, at what point should people start saying, okay, I need intervention. I should see a pelvic floor physical therapist, or I need to see a specialist. When should most of these things like resolve within the normal
Yeah,
time
yeah,
frame?
yeah. Well, I mean, going back to that 6 weeks rule, you definitely want to really give yourself that 6 weeks, just as a general guideline, to know that a lot is shifting in that time frame. The first couple of months, there's a lot shifting and changing. So it is very natural for symptoms of prolapse, bladder leakage, et cetera, to be happening in that first 6 weeks, but then to really resolve to a point that they're not bothersome to the person anymore after 6 to 8 weeks. A lot of people spontaneously resolve just with the natural course of postpartum healing. Now, not everybody, but a lot of people will. So I know that, yeah, many people I know and have spoken to, many clients, and even some aspects of my own story, there was natural resolution that occurred. So I say that only to be like, listen to your body, notice signs and signals, keep an eye on things, but try to just be okay. It's so normal. My body's just been through a lot. Let's see what changes and resolves on its own. Let's give it a couple months. However, that being said, I think everybody should see a pelvic floor physical therapist. So I think as soon as you feel comfortable going to one, around that 6 week mark, maybe. Again, we're not saying everything is healed and perfect for everybody at 6 weeks, but it's just, a marker of giving your body time to kind of recalibrate. So again, around that 6 weeks to 2 months mark or 3 months, whatever, if you can see a pelvic floor physio in person, they're going to more likely have the time and training to really investigate your body, your pelvic floor muscles, the whole muscular structure all around your pelvic floor, and even your posture, your breathing, how you're lifting baby, how you're moving, how you're managing your pressure, all of these physical things that really, really are important. So I would see for anybody with a birth injury, traumatic birth injury, I would talk to a therapist if you feel you need that support, and I'd go to a pelvic floor physical therapist for physical support.
Okay,
Hmm.
that's great.
Hmm.
Do you have any? I mean, I know this was something I really benefited from, like, in some of your programs, you just have like basic lifestyle tips. Do
Yeah.
you have any tips for moms who are maybe early in recovery, things they maybe should and shouldn't do that could impact some of these symptoms and things?
Yeah, for sure. I mean, one is what we really just talked about, not diving straight into anything too intense right away. Give yourself time to heal. Give yourself time to just love your body, breathe, calm your nervous system, all of that. If we overdo our physical capacity too soon, then it can actually aggravate, it can irritate, it can strain the muscles, it can create excessive tension in areas that we do not want that to happen. And so just go easy on yourself. The other aspect is keep moving though, gently moving, walking with your child, your baby, moving your body, doing hip circles, doing little pelvic tilts, doing breathing exercises, gentle mobility exercises is really healthy and important for your tissue health, for the flow throughout your body, for softening scar tissues, as long as it's very gentle and within a
Okay.
range that does not hurt. We're not going for pain. This is not a time for no pain, no gain. That's just not a thing right now. So take care of yourself. Also, avoid straining to poop or lift or push or pull as much as you can. So, nourishing foods, lots of soups and broths and things that fiber, things that keep your stool easy to pass, lots of hydration. All of those things are so important to really think of. So, you're not having to push to poop. You're not having to push to strain out your pee, like to bear down so that you get the pee out fast because I'm so busy and I have a toddler and I have a 10-year-old and I have a brand new baby and I'm so busy. Like I know, but please don't push to pee. Really, really important. Try not to push to poop or pee. And then when lifting. So my program is actually called Lift. And it's not about weightlifting. Well, the idea is like lift, like supported. I want people to feel supported in their body, in their pelvic floor. And I want them to learn how to lift, like literally lift things, not just weights, like a baby, like a pencil off the floor, like, your shoes or a grocery bag. Like we lift things all day long. And especially moms, new moms, we need to think about our posture and about our lifting because both of those things are being impacted all day long when you have a brand new baby. And so lifting correctly is all about learning how to gently activate your core and manage the pressure that's in your system. Because when you lift something, and especially when you transition positions, like when you maybe squat down to get something and then stand up, there's a risk for a buildup of pressure to really push down on your pelvic floor and the scar tissue that you are, the area, if you had a scar, if you had a tear, the area that's reforming and developing, strengthen again. So we want to avoid any unnecessary, like bearing down strain or pressure. So every time you lift your baby, every time you lift anything, it's breathe out, exhale with exertion. Think about your mechanics. Think about gently activating the core when you can. That doesn't happen right away. When right away we are like, there's nothing activating anywhere, and that's okay. But when it comes back, we want to gently activate pelvic floor, abdominals. We want to exhale as we're lifting to manage the pressure. If you ever notice that feeling of strain or bearing down, just think that's not what we want on that area that we're really trying to heal and be gentle with.
And I love that in the lift program, you do so much cueing, and even some of the exercises are putting people in those everyday
Yeah.
positions,
Yeah.
like when you're coughing or sneezing or just getting up in and out of a seat.
Yeah.
Yeah, all of those lessons are so valuable.
Yeah.
And speaking of that, since you just talked a little bit about the lift program, you have several programs that you've made that are tailored to different aspects of pelvic floor dysfunction. Do you want to talk a little bit about those?
Sure, yeah, I have. So what I love about the newest version of Lyft is I've revised it. I've had this program over the years. I actually really made it for myself when I was going through my own prolapse journey after my baby 19 years ago. But then I was using the information with my clients, and over time, I just made it into a course. And I've evolved that course over the years. And the latest evolution is great because it takes you essentially back a step to what I call week zero. It's like an intro week. Before you even start the program, it's this intro week that's all about that nervous system regulation, kind of connecting mind and body, breathing, relaxing the muscles, slowing everything down, a little bit of touch to the body. These really beautiful, slow practices that are not to be skipped. And so before I added that intro week, I would have recommended to almost anybody, you know what? You might want to look at my Overcome program as well as Lift because overcome is for pelvic pain and tension. So it's all about relaxing the entire body, stretches, various tools and techniques to help you relax in a nutshell. So that's my overcome pelvic pain program. And I still think that's a wonderful starting point for anyone who has severe pain or had severe trauma or has, for whatever reason, they feel like they just need extra time before beginning a strengthening program. That'd be overcome. However,
Okay.
that being said, now that I've added that intro week to Lift, that week zero, I feel more comfortable recommending Lift to pretty much anybody who feels they want that strengthening aspect in the long run and those lifestyle management tips. Then my other program is called Begin, and that's just a very short little mini course. Like it's pretty quick, it's easy, and it's really for anybody. It basically teaches you, again, that mind body connection and how to release the muscles because pretty much anybody needs to learn how to release and lengthen before they strengthen.
Mhm.
So begin, overcome, lift. And then I have a program called the Academy, which is the Mind Body Pelvic Health Academy. It's all about the mental and emotional work of pelvic health. So it's really a deep dive for anyone who's like, whoa, I'm totally seeing these mind body connections. I really want a very holistic approach. It's not for a specific pelvic floor condition, it's more for applying the mental and emotional aspects to pelvic healing, but in a more general way. It's a great program. It's definitely a deep dive, kind of like a next step. Yeah. And then beyond that, I have my experience, which is private retreats where people can come and see me in person. So those
Oh,
are
that
that.
sounds so fun. Do
Yeah,
you do
they're
that?
so great.
Is that as a group or do you just do like one-on-one?
One on one. Yeah.
Wow. And how long do those normally last?
So I have an option for 2 full days of care or 3 full days of care. And I do literally 8 hour days of treatment. I combine movement, breath, and extended body work sessions. There are 4 to 6 hours on the table. And that is because I work head to toe. I truly feel, as I hope anyone listening to this has gathered, is that, it's not. a quick fix. When we're dealing with a pelvic floor disorder, it's not just a single exercise and you're good to go. Like, we really need to look at the whole body. We need to look above the pelvic floor and below the pelvic floor. So I do head to toe body work, and a lot of emotions tend to be stuck and held in the body. So we do everything very slowly. Everything is about safety and consent and slowness and really moving at the pace of your body so that your body feels safe enough to really release these long held tension patterns and sometimes even emotional stuff that's stored and held in our tissues. Yeah.
Wow, I'm so interested in that.
Yes.
And we're going to be adding all of this to our website.
Great.
So, anyone watching can go on there and, have a direct link to all these different programs that you have.
Yeah, that's awesome.
Well, thank you so much. I think this was wonderful. I hope everyone learned something. I learned something.
Good. Yeah.
Um,
I hope so too. I want anyone to know that, like, again, I'll just say it for the 50th time on today's talk. It's like it is a big deal. And there's so much that can be done for you to feel better and to get yourself back to feeling great again. Hmm.
yeah, I think we're all capable of doing it. It's just that you got to start with yourself.
Yeah.
The way we talk to ourselves is so important. The relationship we have with ourselves is the most important one we're ever going to have. What I used to do is I would just stand in front of the mirror and I'd look at myself and say, Brittany, you're going to heal yourself. And I just had to tell myself that every single day until it started to happen.
Yeah.
So,
I just heard actually that speaking to yourself in the third person, like saying your name, like Brittany is healed or Brittany is feeling amazing again. That is actually, it's very, very powerful because, like you said, our words do matter. Our words are spells. Our word is our wand. It really matters how we talk to ourselves. And I think there's so much benefit in talking to yourself in first person, like I'm amazing. I am, etc. And apparently there's research that's showing that talking to yourself using your name is actually super powerful too. So
oh,
just thought I'd
well,
throw
I
that in
guess
there.
I was onto something. I'm
Sure.
going to have to start doing both.
Yeah. Yeah.
Well, thank you so much. I can't wait to share this with everyone.
Thank you.
Thanks.